How does it feel to experience online learning?
How is it the computer? Less than ergonomic setup. Zoom fatigue, normal fatigue. We were faced with the question of how to move medical student pracs online in March. There's a lot of things you can do online. This year I've brought work, study, and my social life online. But one thing you can't do is tactile learning. Or can you?
Hello, I'm Christine Barry from Flinders University and I'm a senior lecturer in anatomy and coordinator of second year medicine. As we moved anatomy pracs online this year, we thought about how can we bring students the benefits they get from doing a prac in the anatomy lab into an online environment. We know that anatomy demands two distinct types of learning. There's language learning to identify structures and to describe them, and spatial learning to understand how structures are organised and to recognise them from different perspectives. Important sensory and motor learning happens in an anatomy lab when students can manipulate specimens while thinking about and talking about clinically oriented problems. So we wondered, how can we bring this into an online environment?
We designed a way to teach medical students about female reproductive anatomy by taking them back to kindergarten. Simple, fun, experiential learning used as a framework for complex concepts. They made the female reproductive organs out of plasticine at home via an online module. We supported them online to make the model, but the most important part was that we inspired them to be engaged in their own learning. This effectively allowed them to bring the anatomy lab into their own homes. And this is what they said about it. It was a brilliant and creative way to learn the anatomy. I enjoyed learning kinetically. Sculpting structures with your own hands is an effective way to learn relations. It was a great activity because you can think, well, that's obvious, but have to label it yourself. It's challenging. Feedback from students was 98.5% positive. One example was from a student who in March was on her property up north, doing her study from there.
I'm someone who learns by doing and thought, okay, what have I got around me here that I can substitute for being these various organs so that I can just get this sort of 3D sense of what's going on here? Why not take my iPad and go down to the creek and see what I can make with sticks and leaves? What I did start to see was all my friends posting their Play-Doh pelvic creations on social media, and it was really engaging, and it kind of brought the fun and the social interaction and the shared learning of a practical into their sort of shared online spaces. So I saw all this and I thought, you know what, the anatomy team has done the most incredible job.
Pelvic anatomy is complex and it's an area where a lot of medical students and junior doctors lack confidence. There's several reasons for this. There's a high rate of hysterectomy amongst body donors, so few students have an opportunity to dissect the organs. Textbooks and museum specimens often display the organs in a simplified arrangement rather than the complex arrangement that they have within the pelvis. On top of this, there can be embarrassment or stigma associated with reproductive anatomy.
After the successful reception of the female anatomy module, we have begun working on further similar modules. For example, covering male reproductive anatomy and further clinical implications.
We and the students have had to be innovative in these challenging circumstances.